It's a privilege for me to introduce my second annual report as the Director of Public Health for Torbay. This year, I've decided to focus on alcohol. This is because alcohol plays a significant role in Torbay's local economy. We have among the highest rates of licensed premises to sell alcohol compared to many of our coastal neighbors. Most of us encounter alcohol in our everyday lives, and there are many stories that we all can tell about alcohol. What I want to do in this report is to examine how trends are changing and to confront us with some of the patterns of alcohol use that are important for us here in Torbay. We know, for example, that alcohol consumption, at least as reported by younger people, is decreasing across the country. Some 1 in 5 young people in England are now reporting that they do not drink at all. However, for young people, the pattern tends to be more of binge drinking among those who do drink, concentrating alcohol intake, for example, during weekends, in social type activities, nights out, etc. Some of the stories about alcohol, however, haven't changed much over time. Many are social drinkers, and alcohol consumption is a normal, one might even say, natural part of everyday life. It is common when we socialize. However, for some people, that social drinking pattern can slip almost imperceptibly into dependent drinking. And it's difficult to determine at the onset which person will be able to have a healthy relationship with alcohol and which person might slip into dependent drinking, where alcohol becomes an addiction and begins to affect their ability to function normally in their work, in their social and family relationships. And in Torbay, that is particularly important because we know that alcohol features strongly in those families where children are at risk because of abuse and neglect. And it features very much in those assessments where we have to look at children in need. We also recognize that alcohol plays a role in many of the young people who are excluded from school. And that is something that we need to look into in greater detail to understand the dynamics of alcohol in those situations. The concern in Torbay, however, may be that many people who may not consider themselves to be problem drinkers, however, drink a little too much for too long. And very often, the first indication that there is a problem with alcohol is when that person develops a medical condition that's related to their cumulative harms from alcohol consumption as a result of drinking a bit too much for too long. So Torbay, for example, has a higher than average admission rates for alcohol-related conditions. The message then is to understand these different stories and to find ways where we can promote a healthier approach to alcohol consumption. The guidelines are that if we do drink, that we restrict that to no more than 14 units per week. And more importantly, that those units are spread over time, allowing for days when we do not drink at all. Of course, if women are pregnant, then it is important that they do not drink particularly because of the adverse effects on the unborn fetus. Each year I make a number of recommendations, and this year I've made 6 recommendations in this report, and they focus mainly on the importance of celebrating responsible drinking, and want to encourage our local premises to offer and promote more no and low alcohol options so that people can feel they can go out without feeling pressured to drink. We want also to promote the use of alcohol screening tools so that people can be more aware of whether they are indeed falling into the pattern of drinking where, although it may not be a problem, they may not be getting visibly drunk, but they may be taking in a bit too much over too long a period, and as a result, exposing themselves to long-term risks. It's important that we understand how alcohol is affecting the lives of young people and children and families, and to support those where alcohol may be creating a challenge in terms of family life and the protection of children and young people. That means we need to understand better about the role of alcohol in exclusions from schools, and understand what we might do to mitigate some of those effects that we've been seeing. We know that measuring alcohol, understanding and tracking alcohol use can be complex, and there are a number of tools that are available, such as My Drink Aware, which is an alcohol tracker app. Similar type tools we want to promote as widely as possible so that people are able to have a really good handle on their alcohol consumption. And the last one is about ensuring that people have the support that they need, and we have very good alcohol support services in Torbay, and to ensure that people are aware how to access help if they or members of their family are having problem drinking for whatever reason. I hope that you find the report a good read, and that you are working with us to implement these recommendations over the coming year. Thank you so much.